Hi, I'm Dr. Kate Lambert, and in this video we're going to go over postoperative care after frenectomy.
First, we'll go through the importance of these stretches, because if you understand how the mouth heals, you're more likely to do them. Then I'll go through the stretching schedule. Then we'll go over the upper lip stretches, the tongue stretches, and last we'll go over the sucking exercises. Starting several days after the procedure, the wound will look white or yellow. This is a completely normal response and not an infection. Just like a scab will turn white or yellow when you swim in a pool, when a wound is constantly wet, it will take on this appearance. It can also be bright yellow in children with jaundice. Full healing may take a couple of weeks before it will go back to its normal pink appearance. There are some important principles to understand about oral wound healing. Any open oral wound likes to contract towards the center as it is healing. If you have two open surfaces in the mouth in proximity, they will try to heal back together. Because of these concepts, stretching and exercises are necessary for optimal wound healing and outcomes. These exercises will allow the wounds to heal open and apart rather than constricted and together. We want the babies to be able to use their anatomy to the best of their ability, which means keeping the new frenum further back and more flexible as it heals. The most constriction happens around days 5 through 7, and we ask parents to stretch well during this time. Stretching should be done 4 to 6 times per day for the first 2 to 3 weeks, with tapering off during the 3rd and 4th week. These exercises are meant to be efficient and precise, not forceful and prolonged. They should last for less than 10 seconds, and the idea is to visualize the entire white diamond and make sure that the widest part has not closed down onto itself during healing. The stretching exercises are best done with your baby placed in your lap or lying on the bed with their feet going away from you. Wash your hands prior to the exercises. Gloves are not necessary. Start with the upper lip stretch if there are multiple areas that require stretching. Typically, babies don't like to be stretched and they may cry, so starting with the lip allows you to visualize underneath the tongue easier once the baby has started the stretching exercises. For the upper lip, simply place 2 fingers under the lip and move it up as high as it will go until it bumps the nose. Bleeding may be normal during the stretch for the first day or 2, or after a long rest. Then, gently sweep the lip from side to side for several seconds. Remember, the main goal of this procedure is to separate the opposing surfaces of the lip so that they cannot heal together. Here's a video of the upper lip stretches.
This video has been slowed down so that we can see the upper lip stretch. The baby was first sucking on a finger and then moving your fingers to the upper lip to move the lip as high as it will go, bumping the tip of the nose. When the lip has been moved as high as it will go, you can visualize the diamond-shaped area where the frenectomy was completed. In this case, it has not turned white yet, as this video was taken just shortly after the procedure was completed. During this stretch, you can also gently move the lip side to side if you feel any tightness in the corners of the site. Here's the video in real time, lifting the lip and bumping the nose.
The tongue should be stretched by inserting both index fingers and diving under the tongue to pick up the center of the tongue towards the roof of the baby's mouth. You should see the white diamond of the healing site and make sure that the widest part has not closed down onto itself. It is helpful to think about pushing the tongue back and up towards the palate during this stretch. We reassure families that it is impossible to open up the area where they had the revision past where it was originally released. Then focus on lifting the tongue up as high as it will go towards the palate and as far back as it will go, holding for 1 to 2 seconds. It helps to use your other fingers to provide counter pressure on the lower jaw. Starting at week 2, you can also use a sweeping motion to rub your finger under the tongue completely from left to right to soften the fibers that are laid down during healing. Bleeding may be normal for the first day or 2, or after a long period of rest. Again, the goal is to reopen the diamond-shaped site at the underside of the tongue. Here is a video of the tongue stretch.
First, we are going to put our fingers on either side of the gum pads in baby's mouth with a light tapping motion. The tongue should follow your fingers and will help to warm up the area. Then, with both fingers, we will slide under the baby's tongue and bring our fingers together at the top of the white diamond, applying pressure to the underside of your baby's tongue. Again, this motion is to move the tongue as far up and back as possible towards the baby's palate, pushing slightly past any resistance and holding for 1 to 2 seconds. Remember, due to the fact that your child is laying back, the motion of lifting the tongue will feel as if you are levering the area backwards as you lift the tongue. You will want to visualize the white diamond of the healing site and flex the tissue, extending and elongating the diamond. Let's say this one more time at full speed.
For the sleeping tongue stretch, wait until your baby is sleeping or drowsy. During sleep, the child's tongue ideal position is on the roof of the mouth. To open the mouth, apply gentle downward pressure to the chin. You want to pull the skin of the chin slightly downwards to relax the mouth and stretch the frenectomy site as the tongue stretches as well. Then, once the tongue has lost its suction, you may close the mouth, press beneath the chin to recreate the suction of the tongue to the roof of the mouth, and then repeat this stretch 3 times.
Here's a link for a video on the sleeping baby posture hold.
Sucking exercises are important for babies who have disorganized or weak sucking patterns and are important to improve sucking quality. Let your child suck on your finger in a tug of war. Insert your index finger or a pacifier into the baby's mouth and let your infant suck on your finger. Allow him or her to pull your finger inward and then slowly pull your finger outwards until just before you lose suction. If your child has a hard time initiating the sucking response, you can use your index finger to tap on the front side of their palate a couple of times before starting this exercise. Repeat then 5 times. Here's a video of the suck training exercise.
It is helpful to think about the sucking exercises as a tug of war. Let babies suck and pull either your finger or the pacifier in with their suction. Then slowly pull your finger or the pacifier out until just about to lose suction. Then let them suck your finger or the pacifier back in and repeat 5 times.
I hope that this was helpful, and please check out our other videos. And as always, if you have any questions about your child's specific procedure or healing, please feel free to call either of our Winston-Salem or Kernersville office.